Our primary care mental health support service was set up to improve the mental health care for people in Gwent with mild to moderate and severe but stable mental health and behavioural problems. The service is currently managed by having a clinician attached to each GP practice across Gwent, with the majority of work taking place in surgery premises. More recently, due to the changes that we have made to respond to COVID-19, the service has been delivered by phone or using online video. There are a number of challenges that the service faces. GPs and primary care teams are seeing more and more patients experiencing mental health difficulties. There is difficulty in getting all of the right staff in the right place due to the way services are currently organised. And also there are less rooms available in GP surgeries for us to deliver our services there. Over the last 2 years, we've been working with primary care to better understand how many people are needing support with a mental health issue. This work has helped us to understand the type of mental health problems that people commonly go to their GPs with. We've also undertaken some surveys with patients who are using our services to find out what's important to them. Typically, speed of access, seeing the right person and in the right location were highlighted as being important factors for people. Based on this work, our plan is to introduce new roles to help support GPs to meet the needs of individuals with low-level mental health problems. These roles, which we call psychological wellbeing practitioners, will work across a number of GP practices and offer assessments, advice and signposting to other services within the community, or enable people to access more specialised mental health services. These practitioners will help to support individuals whose conditions are not severe enough to need more specialised mental health services, but whose needs cannot currently be fully met by their GP. Similar roles are already well established within NHS England, but will be new to Wales. We're proposing 36 new psychological wellbeing practitioners to deliver this new service across Gwent. We have already started to recruit into some of these roles. The introduction of these new roles should improve access to advice and support for individuals with low-level severity of mental health issues who would normally go to see their GP for help. It will also mean that GP time is available for people who need their medical skills. As part of this engagement, we are also proposing changes to the way in which we provide our primary care mental health support services. Following 2 workshops held at the end of 2018 with stakeholders, our proposal is to introduce a new way of organising our primary care mental health support services based around neighbourhood care networks. Neighbourhood care networks are made up of a small number of GP practices working together to provide primary care services within their community. To do this, we would like to introduce a hub-based model for delivering our services. Under this proposal, there will be a central point for all referrals, which would mean that there is a single way of managing waiting lists across Gwent. Patients who require a face-to-face appointment will be offered an appointment in a community-based hub rather than at their GP practice. All activity would be undertaken within these hubs, including mental health assessments and individual and group-based therapies. We need to do further work on where these hubs may be and would like to keep talking to you about this. A GP dedicated email address would also be set up to provide immediate advice to directly support GPs. As part of the extension of choice to service users, it is also proposed to continue to offer some phone computer-based assessments and some interventions virtually, in addition to the option of having face-to-face consultations. This offer will be made at the time of booking an appointment. The NCN Hub model should result in better use of resources, shorter waiting times overall for patients, and more equitable access to a range of treatments that can be offered in each area. We believe it will also result in a more sustainable clinical workforce. It is acknowledged that there are likely to be individuals that will have to travel a little further for an appointment as a result of these changes, but equally a number of service users are likely to need to travel less.